So I have a three-part question for you. What medications do SCAD patients, typically take? How long will I have to take them? And what should I do if I have side effects?
Okay. So it really depends on whether or not the SCAD is treated with stents or not. So majority of patients with SCAD usually will not actually require stents for treatment. And based on that, medical therapy is the mainstay of treatment. And that medical therapy, and by medical therapy I mean with medications, usually will include aspirin, what we typically refer to as a baby aspirin, so typically 81 milligrams a day. And the purpose of this is to help with arterial healing and help reduce the risk of clots forming within the artery itself. And the best evidence for it is usually a year of aspirin, and in most cases, we would recommend aspirin lifelong. If patients who don't have stents, the other medication they typically will be on is a beta blocker. So beta blockers are medications that help reduce the force that is felt by the wall of the artery in the hopes of reducing the risk of having another dissection. Now, beta blockers they do actually have evidence in observational studies that they can help reduce the recurrence rate of SCAD by up to 70%, which is why they are very strongly recommended. In this case, though, there's no great data that tells us which specific beta blocker, how long that beta blocker should be used, at what dose exactly. And so for the majority of patients, we recommend that they take their beta blocker at the highest tolerated dose for as long as possible. Lifelong, ideally, but as long as they can tolerate. And we recognize that for some patients, how high the dose goes or how long they could take it may be limited by things like low blood pressure, a slow heart rate, and in some cases, some of the side effects of beta blockers. But our goal is as long as possible, preferably lifelong. Now, in patients who have stents, aspirin is a mainstay of therapy as well, but there is also a second blood thinner that is used to keep the stent open, and that's usually taken for 1 year minimum after the implantation of a stent. So the alternate blood or the second blood thinner is usually a medication called clopidogrel or ticagrelor. Clopidogrel more often has a bit more data than ticagrelor. In addition, other medications may be prescribed based on the individual patient's consequence of their heart attack. So if their heart attack has left them with heart muscle damage, heart muscle dysfunction, or what we call congestive heart failure, where the pumping function of the heart is impaired by a certain amount, patients may be required to take additional medications such as ACE inhibitors, so angiotensin-converting enzyme inhibitors. That's a class of medications. Common ones within this class are drugs like ramipril, perindopril. Cousin drugs of that class, angiotensin receptor blockers, so these are medications like candesartan, valsartan, and other medications in that class. They may be required to take spironolactone. They may be required to take sacubitril valsartan. So these are combination drugs that all help improve heart muscle function over time. If patients have cholesterol problems, which are usually not the mechanism of SCAD, they may be required to take cholesterol-lowering medications. However, these medications are typically not used in SCAD specifically because SCAD is not a cholesterol-mediated problem. However, if patients are discovered to have cholesterol plaques within their arteries, separate from the SCAD event, cholesterol-lowering medications may also be required or may be suggested. And lastly, a nitroglycerin spray is often prescribed to be used in the event that there is breakthrough chest pain, and that will help mediate or mitigate some of the chest pain that patients experience. Those are the usual medications. And of course, if side effects are experienced, the most important thing is to contact your doctor, contact your family physician, your primary care provider, or your cardiologist to discuss the side effects that you are experiencing and discuss how to manage them.